This video will discuss the use of oxygen and humidification for a child with a tracheostomy. Sometimes we use oxygen to make sure the levels of oxygen in the body are safe. Humidification means making sure the air the child with the trach breathes is moist. Making the air moist protects the lungs. If the child with a trach is on a ventilator, attach the oxygen tubing to the oxygen source and to the oxygen port on the left side of the ventilator. For children with a trach who are not on a ventilator, there are 3 different attachments used to give oxygen. These attachments are a heat-moisture exchanger with oxygen, also called an HME with oxygen, an O-ring or a pressure line adapter. The HME with oxygen connects to the end of the trach tube. Oxygen tubing is attached to the port on the side of the HME and to the oxygen source. The HME with oxygen can be used to give up to 2 liters of oxygen. Giving more than 2 liters of oxygen with an HME with oxygen can cause difficulty breathing. The O-ring also connects to the end of the trach tube. Oxygen tubing is attached to the port on the side of the O-ring and to the oxygen source. The O-ring can be used to give up to 2 liters of oxygen. Giving more than 2 liters of oxygen with an O-ring can cause difficulty breathing. If a child with a trach needs more than 2 liters of oxygen, use the pressure line adapter. The pressure line adapter connects between the trach, mask, and the humidification tubing. Attach the oxygen tubing to the port on the side of the pressure line adapter and to the oxygen source. The pressure line adapter can be used to give high levels of oxygen. Humidification is very important for children with a trach. They are not able to humidify or moisten the air they breathe normally. Lack of humidification can cause trouble breathing and other breathing problems. If the child with a trach is on a ventilator, humidification is provided in one of 2 ways. The 2 ways are with a heater or with an inline HME. The heater is attached to the ventilator tubing. If the heater is not in use, the inline HME is attached between the trach tube and the ventilator tubing. For children with a trach who are not on the ventilator, there are 2 different ways to provide humidification. The 2 ways are cool mist or HME. Cool mist is delivered by using compressed sterile water, corrugated tubing, and a trach mask. The trach mask is secured around the neck and covering the trach tube. Take care to make sure the trach mask stays in place over the trach. If the cool mist is not in place, use the HME. There are 2 types of HMEs. These are the HME and the HME with oxygen. Both HMEs attach to the end of the trach tube. Remember that oxygen and humidification are very important for your child's health.